My name is Richelle Heldwein. I'm Chief Risk and Compliance Officer at St. John's Hospital in Jackson, Wyoming. I came here 6 years ago and I thought I had the best job in the world when I was working as a consultant, and St. John's was one of my hospitals that I consulted with. They convinced me to come here and work full-time, and it has been the best job that I've ever had. The breadth of what we do in compliance and risk and quality really does touch every corner of the organization. I think we do that in a real unique way because we touch staff members where they're at, and we look at what their processes are, and we look at the things that they're doing, and we work with them to try and help them have processes that work better for them, that really can improve their working environment and improve the performance that we have overall. St. John's in Jackson, Wyoming is a unique place to work. There is lulls and there are peaks, and those peaks can be as high as the Tetons when we're talking about influx of people that come in. Being the tourist destination that it is, especially very early in the pandemic, we knew we were going to get hit. We had busloads of people that tested positive for COVID early in the pandemic before everything was completely shut down. Our connection with University of Utah and our weekly COVID calls were like a life raft for us. Being able to get on those calls with all of the affiliate hospitals and hear their processes for approaching COVID testing and approaching really staffing and all of those kind of things has been like a life raft for us. We transfer our really sick patients out, and we need beds for them. And having that University of Utah affiliation and being able to get our sick patients where they needed to be is so, so important for us. Not just for COVID patients, but for other patients as well. Being able to really have that affiliation and those bonds strong that allowed us to always find a bed when we needed to transfer a patient, to always find a bed for that patient for the level of care that they needed to have. Those affiliations were so valuable to us, and it really is a culture of camaraderie and a culture of working together to make us better. I actually live in Southeast Idaho. I'm about 2 hours and 10 minutes on a good day from the hospital. I commute to work. I do that because I love this place and I love where I work. I'm willing to sacrifice to be committed to this organization because I really like the people I work with. The vision of the organization and the strategic plan of the organization is all built around people and quality and values that we all hold high as individuals and can work together with as a team. And that's what makes St. John's St. John's.